The financials are a trailing metric. By the time they show distress, things are already structural and down the road by 6 months. Quality metrics run on annual cycles or quarterly cycles. So definitely the huddle. The huddle is happening now. It's happening today. Honestly, in 90 seconds, you can tell whether information moves out or whether it doesn't.
All right, most healthcare organizations think they have a communication problem. Larry here thinks they have an information problem because the people closest to the work, well, they know what's happening. Leadership might not just be hearing about it. In his latest article on The Operator, Larry brings forth that most healthcare huddles have become broadcasts, theater, or what he calls a metrics huddle, where the venue that was supposed to be the platform's eyes and ears has become just a daily reminder to hit budget. And when that happens, the platform learns none of it. So Larry, let's start there. What is a huddle actually supposed to do?
What is a huddle supposed to do? A huddle is absolutely supposed to, it's easier. Actually, let me back up a little bit by saying organizations don't really have this sort of communication problem. As you said, they have an information problem. I'd like to start out with what is the fundamental difference between those two. A communication problem is when the message doesn't get through. An information problem is when the message that is needed to get through never even makes it to the room, never even makes it to the thought that I should be communicating this. We have too much data, not enough information. We have too much information, not enough communication. Most healthcare platforms communicate constantly. Email, Slack, Teams, channels, dashboards, monthly all hands, weekly newsletters. There's no shortage of talking happening. What is missing is the small, really what I would say hard, specific information that lives on the clinical floor. The chair that's been broken for 11 days, the new hygienist who feels like she's bothering someone every time she asks, the senior clinician who has been quietly looking for job postings since February. Nobody knows that they might be a flight risk. That information doesn't move through email, Slack, and channels. It moves through trust, through proximity, through a venue where it's safe to raise, what we call psychological safety. If the venue does not exist or people don't feel safe, it sits on the floor and the platform, obviously doesn't see it. So you can have crisp communication and zero information. They're not the same thing, and we get in troubles when we conflate the two. So the huddle is the venue specifically, now to get to your key question, the huddle is the venue specifically designed to surface that information. That's its purpose. When it works, you have both communication going down, information going up. When it doesn't, you have a lot of well-designed slide decks and data describing a reality that the leadership team, fortunately, doesn't really even see.
In the article, you opened with this line. I even made a note about it. The meeting happened, the huddle did not. How can two organizations really run the same exact meeting, yet one learns something valuable and the other learns nothing?
Yeah, well, because the meeting is the visible, 10%. The other 90% is the system around it. So two huddles can look identical from across the room, same time, same people, same checklist, same length. The difference is what's happened in 18 months leading up to that point. So I've been through huddles. I've been to a lot of daily huddles when I visit locations, whether it be a PT clinic, a dental clinic, primary care clinic, occupational health, you name it. The huddles oftentimes will have that same checklist, and it is whether or not you're just checking the box or whether you're having meaningful, conversation. In the organization that learned something, the floor was watched over and over what happens when they raise a hard issue. So issues get sort of logged, owners get assigned, but by Wednesday, the chaos is either fixed or it's replaced. By Friday, somebody walks to the back of that clinic and says, "We got this done." That's a system that's earned the right information from its floor. It's actually resulted in actions that are measurable and held accountable. In the organizations that learn nothing, the floor has watched the opposite happen. Issues get raised, issues get parked, nothing happens. By the third or fourth time when that happens, the floor has decided, without anybody announcing it, that the huddle is not the right venue to tell you things that are really worth telling you. They just show up and they check the box. And then they go back to, seeing patients. So the meeting still happens, but the huddle is dead. It's just, did we do a huddle today? Yeah, in fact, we certainly did. but it didn't serve any real purpose. And so the difference between those organizations was not the meeting. Both organizations had the meeting. The difference is whether or not what surfaced in that meeting reliably catches someone who acts on it. There's a psychological term called habituation. We get used to things. We get desensitized to things over time that are rote. And what you have to have is you have to have a meeting czar, somebody that's frequently like, what's the purpose here? Are we really surfacing issues that's going on in here? And maybe that meeting czar changes every couple months or every quarter or whatever. But you have to have somebody who keeps meeting accountability. Otherwise, it becomes rote, habituated, and accomplishes effectively nothing.
Yeah. To go back to sort of making sure we know your terms, most people think a huddle exists to communicate information, but in the top of the show, in the article, that feels more like a broadcast or performance theater. You argue that it exists to gather information, uncovering things, a place that leadership might not have visibility. So how would you, if someone was starting tomorrow in leadership, how would you describe to them, hey, this is what a huddle is actually supposed to do, so you know what it needs to achieve while you're in it, what the goal is?
Yeah, that's right. And again, you have to go for what is the purpose of the meetings. And so there are meetings where you're meant to broadcast information and headlines and updates, those kinds of things. But a huddle is not a broadcast, it is a sensor. So if you really think about it, and you trace this historically, I think it was around the 1940s that Toyota really, really perfected all this. And by the way, the guy's name really was Toyota. It was just spelled a little bit differently than I think the car is. And he built it as a daily stand-up on the manufacturing floor, designed for one problems: surface problems that are small and fixable when they're cheap. Healthcare imported this practice in the early 2000s after the Institute of Medicine to air his human report. That was kind of a famous report, and AHQR formalized it into the team steps, documented this results from across multiple settings: fewer medical errors, fewer near misses, and fewer adverse events. So basically, we took manufacturing this ongoing cord where something goes bad, we got to fix it right before bigger problems happen later. We imported it into medicine, and it was effective. And it was effective because the mechanism was not the meeting. The meeting was the upper flow of weak signals, something we can notice that's out of source when it's small and weak, and closest to the problem really reporting it before those signals become events. One of the meetings I absolutely hate in any organization is when you have an operational meeting and those that aren't closest to the report are reporting the meeting. So the way that manifests itself like a large physical therapy or healthcare organization or dental organization, you don't have the local operators, regional directors, regional business partners, whatever you call them, and the practice managers in those meetings. You have their direct reports. So think of the information flow. You're having direct reports of direct reports trying to relay information. And when all that things start to happen, it just doesn't work. And so that's why you have these huddles at the most local level where information could flow up. The Toyota factory floor and the operating room have one thing in common: silence is never the absence of any kind of issue. It's almost always the presence of a system that has trained people closest to keep quiet. You want people closest to speak. In the Toyota world, they had an on-down cord that they actually pulled the cord because they were so scared to speak. Think of that same mechanism, but get people to talk. And in small huddles, if you do psychological safety correctly enough, and you emphasizing it becomes cultural, people will speak.
Yeah. Well, I think that's one of the strongest ideas in the article is that as you said, the people closest to the work actually know what's going on. They understand why a broken chair matters. They understand why being down one person matters. The platform might just never hear about it because we're sort of playing that game from third grade, telephone. By the time it gets transmitted, exactly, you've lost some meaning. So what kinds of problems are frontline employees seeing every day that maybe through that telephone game that leadership might miss?
Yeah, I like to call them patterns, not events. So the dashboard, back to the KPI and the metrics, will tell you that, Mrs. Jenkins didn't come in. It will not tell you that the front desk has now had to apologize to her 3 times about the same scheduling glitch that took place in the EMR, the scheduling system. The dashboard will tell you production was down 4% in a region. or no-show cancellation was up, but it will not tell you, for example, in a dental world, that the hygienist, with 12 years of tenure spent her lunch yesterday updating her resume and left. Right? The floor sees things that metrics that precede metrics. They're like leading indicators. They see the patient coordinator who's one bad week away from quitting because we keep superimposing and accreting more responsibilities to the patient coordinator. They see the chair in the op 3 department area that has been broken for 11 days and it's now affecting 2 clinician schedules because nobody's taken the time to get it fixed because nobody has escalated it well enough. They see a new dentist who's really, really good, but culturally just not fitting in. They see supply and ordering, and it happened. This is where I see a lot of this stuff happening, and all this stuff gets mad, and everybody then gets mad at procurement. And procurement's not the problem; it's the problem occurring at the front, and it just never surfaced. None of that stuff, Jimmy, is on a dashboard, and if it is, it's 6 months from now, and it manifests itself downstream in the form of a problem. The thing the floor has that no other layer in the platform has is the time spent next to the work. It is right there. 6 hours a day, 8 hours a day in the same place, watching the same patterns, noting the same things going slightly wrong. And anybody, you got to have things go wrong before anybody could see it. So you can't get that information in the room with people who act on it. You have to. If you're not getting that information, you're operating blind. And so I view those things again as patterns, not events.
Well, if the meeting goes well, it should be quiet, right? No problems. But you say that silence is almost never the absence of issues. It's usually evidence of a system that has trained people not to speak, to have that psychological, that fear of, I don't know if this reaches the threshold of being worthy of being brought up in the sacred meeting. So how's that happen? Because I don't think many leaders wake up trying to create that type of environment, right? We always hear from leaders, I've got an open door policy. So how's that happen?
Yeah, it's an unintended. You're absolutely right. It's an unintended consequence. Nobody decides to build it; it just accretes. And I think it happens in sort of small moments, none of which happen in isolation. The first time somebody on the floor raises a real issue and gets let's discuss that offline with no follow up. Let's take that offline is a classic one. The first time a regional person rolls their eyes at a suggestion. Somebody makes a suggestion, the feedback is the eye rolling, like you're a little kid. The first time an assistant brings up a safety concern and somebody says, let's not get into that right now. Let's just defer. We got too much going on. That's a bigger issue. We need to discuss that separately. The first time a COO visits a clinic and the team is told to clean up the room before he or she arrives. Right. Oh, we know Larry's showing up today, so let's make sure everything looks good. And those are symptoms. Again, single moments. Each one of those teaches sort of this small lesson. But by month 3, the lessons accumulate into a normalized behavior in an operating environment. By month 6, the rule is invisible, internalized, and it doesn't get brought up. Interesting study done by a lady by the name of Amy Edmondson at Harvard. She did all this incredible research. I had to leave this out of the article. And she's the one who really termed all this, by the way, psychological safety. But the catastrophic finding that she came up with is that in environments where you do not have psychological safety, they don't reduce problems. They reduce the reporting of problems. So think about that. It's not the problem, it's the source of the problem. It's the lack of reporting it and how it surfaces. And when you have low psychological safety, you actually decrease the reporting of problems. What really good leaders have figured out is they're problem solvers and they want more and more and more reporting of problems to happen. So you have to have a platform that's flying through clouds with instruments off when you don't believe there are problems. It's not that they're not problems, it's not that they're being reported. And there's a lot of time pressure and all the other kind of things. But the good news is that the same dynamic actually works in reverse. 5 months of visibly acting on every issue raised will build a floor's willingness to speak. It's not the magic, it's the patience and the follow through. It's just like what they found years ago in putting the alert system in a hospital bed. When they first started doing that, they were worried that the alerts would go off all the time. And you know what? They did. And each time they went off, a nurse would have to come in and respond to it. But over time, when you could preemptively solve problems and surface them, then the alerts started to get less and less frequent, and they served a very, very valid purpose. So early warning signs, an andon score, all those things are really, really beneficial. Reward people for reporting.
Yeah. Yeah. This reminds me of my dad told me a story. He was a New York City fireman. And after every big fire, everybody would go get showered and come down to the kitchen, and they would just go in a big circle. And whether you were the guy who was there for 30 years or you're the guy that were there for the first 30 days, what did you see? What did you learn? Why did you do it? What do you think we should do next time? And they talked it out in public, and there being open and honest was rewarded because lives were on the line.
Absolutely. Absolutely.
So reading this article, I kept thinking it doesn't sound like a meeting problem then. It sounds like a leadership, right? This should be a reflection of leadership. So what's the difference between a manager who gets information and a leader that people are actually willing to tell the truth in front of? I'm going to guess it's absence of eye rolling has got to be on the list.
100%. A manager, the way I look at it is a manager builds the venue, but a leader earns the audience. They are the heart and soul of the people side of it. The manager side of it is just setting up the physical environment oftentimes. So the venue is necessary, but not sufficient. You can have a perfectly structured huddle, a perfect cadence to the meeting, the right people, the right prompt, the right cadence, run by a leader that nobody on the floor trusts, and nothing ever real comes out of it. And the floor will smile, there's no concerns, and everybody will kind of go back to work, and it'll be a very quick huddle. And that's what happens over time if you don't do this thing appropriately, is to become very, very short. Oh, nothing goes on. Let's just, you get positive reinforcement to end meetings way too quickly. But what earns trust is actually mechanical and somewhat unglamorous. It's the leader who gets the truth from the floor with the same set of habits every time. They show up consistently. They listen without interrupting. They are genuinely curious. When something hard surfaces, they're adult and they want to embrace them. They don't get reactive. They don't get defensive. They react with curiosity. They don't shoot the messenger. When they are wrong, they say so publicly, I was wrong. I should have listened to you. If I would have just held on, if I would have had a little more patience, I would have listened. This problem would never become a problem. And that's what good leaders do. And they also explain it. None of this, by the way, is exotic, right? All this is hard because the gravitational pull on a busy leader is to multitask. It's to dismiss inconvenient information. It's to defend. It's to overcompromise. It's to try to be more efficient rather than to be effective. But the leader who resists all of those instincts over and over in small moments accidentally builds an organization which the truth reliably travels up. And overall, they do truly have less problems. The manager who follows the playbook gets it right in the venue, but gets no information. The leader that builds the relationship gets the information, whether or not the venue is perfect. The leader is the relationship manager. If you want to know whether you are one or the other, you really want to know what the litmus test is, look at what's being raised to you. If it's all good news, polite questions, and well-formulated, updates, you're managing a venue. You're not leading anybody willing to risk telling you the hard thing. What I tell folks all the time is a good leader, and I would say this to a friend, a good friend is somebody who's willing to risk their friendship to tell you what they need to. And that takes a lot of trust and a lot of psychological safety.
Yeah. You were sort of preempting my next question, which was going to be, if someone's a CEO and they think their organization communicates well, what are the signs that they're actually operating with a false picture? One of them right there would be, you're not just getting smiles and nods. You're not just getting good news. People are telling you different things. Are there other things that would sort of let you know that you are actually operating with a good organization and good leadership?
Yeah, I would say there's, I can think of a handful. One, if you've not genuinely been surprised by anything in, let's say, the last 90 days, really surprised, you're probably not seeing it. Number two, no bad news ever reaches you first, right? Like by the time you hear a problem, it's already been resolved by someone below, or it's metastasized into a crisis. The middle window, here's the thing that is going wrong, we have time to fix it, we need your help, has gone missing from your inbox. Additionally, I think your one-to-ones with your folks are all upbeat. there never is any, what I call creative abrasion, anything going on there that you're in disagreement about. And you can't have that. If it's only good news, the only people reporting to you because they know you only want to hear good news or they're in fear of you, that is the telltale sign, as you alluded to. And then, I think when you visit a place, if everything is looking perfect and it was all brushed up for the regional leader or the manager, everybody's smiling, everybody's putting on a show for the management. That's not a good thing. And then maybe lastly, the CFO is a different operating structure than your COO, and neither one of them has a picture that matches your like chief marketing officer or something like that. So when the three folks sit in a room and describe the same platform, the description should be dramatically different. That's not normal. This is the platform's nervous system disagreeing with itself. So the CMO has heard one story, the CFO has heard another, and if all these things are going on disparately, you've got a problem. And so it's time for you to get out and walk the floor yourself. So it's the inconsistency in your C-suite reporting things to you. That's not a good, that's a telltale sign.
So for the big finish, if you walked into a healthcare organization, doesn't really matter what they provide, and could observe only one thing to determine whether it's healthy or unhealthy, would you watch the financials, culture, outcomes, or watch the huddle? And which would you watch and why?
It's not even close. I'd watch the huddle. The financials are a trailing metric. By the time they show distress, things are already structural and down the road by 6 months. Those are the outcomes, right? Quality metrics run on annual cycles or quarterly cycles. So definitely the huddle. The huddle is happening now. It's happening today. Honestly, in 90 seconds, you can tell whether information moves out or whether it doesn't. I once listened to a marriage expert, Gottman, I think his name is. He's been published more than anybody else, saying he can tell within the first X number of seconds whether a marriage is going to have a high rate of divorce or not. Well, how do they tell that? A marriage huddle. When they're talking to one another, how are they respecting? What are they saying to each other? Are they looking themselves in the eye? What is the trust that's going on? So really the huddle is that nervous system on display. I'd rather watch one of them for 90 seconds than read a whole board deck of PowerPoints. When I visit clinics, I usually ask to participate in their morning huddle or to be able to observe their morning huddle in a unambiguous way. I break the ice at the beginning, and then they know I'm not going to lead it. I just want to watch, and that will tell you from 2 years hence what's actually going to happen.
Most leaders think they have a communication problem, and as you've figured out from listening to this, many have an information problem. The question probably isn't are people talking. The question is, are leaders hearing what they need to hear? If today's conversation made you rethink how information moves and make you uncomfortable, good. That's the point. And you'll love the deep dive in the article it's available in the show notes. Subscribe on Substack using the link in the show notes attached here. Subscribe to the podcast, and we'll see you next time. Larry, thanks.